I think it's so important to know what you're getting into and make good decisions. And when we chatted, you shared something with me that I'd never heard from anyone before. And you shared with me, I think it was IVF that you went through the
Hmm.
last time. And
Yes.
again, please correct any details. And you said it was so difficult on your body, but you're blessed with your son. But had it
Hmm.
not taken, you weren't sure if you would have done it again. So would you mind
Yeah.
just sharing a little bit about that? Because again, I mean, I think we see the highlight reel a lot of times from people like, oh, I did IVF and here's my baby. And, we don't always hear the difficult part of the journey.
Right. So I grew up in a very chemically laden household. I only ate TV dinners, processed foods, all of that growing up. And so in my 20s, I went very clean. And I eventually became organic only vegan person. And that's where I've been for many years, since 2014. So going into first IUI, it was a couple different medications that I could feel the hormonal changes, but it was tolerable. And I was originally didn't even want to consider IVF because I knew it involved injections and a lot of medications, and I don't do medications. So going into it, it's like, okay, this literally is my one chance. I am not going through it again. And luckily, my fertility levels were very, very good of like a 20 some year old person, even though I was 40 at the time, or yeah, 40 at the time. And so I had to do about 50 different injections into my abdomen at all times. And I'm sure Rabia knows, like you're doing 5 or 6 different medications every day, several in the morning, several in the evening, and you don't know what's up or down. And I held on pretty well just because as long as I knew that there was an effect, something that was causing the emotional swing, I could pretty much mask it or at least not treat anyone else differently because of the medications. But I do remember they got my estrogen, which is normally 20, 30, 40, maybe get up to a couple hundred. It got up to over 6,000 at the height of it right before they were to do the surgery and get 20 eggs. And so they didn't even give me the full heavy dose of medication that they usually give people. I was on a lower dose, but it was still so traumatic because I'm so sensitive to any type of medication. And just for people listening, I get sick with ibuprofen. Like that's how sensitive I am. Like anything I put in me, I get really sensitive. So it was a big huge swing. And then to find out when they transferred the embryo that I had to be on more medication, I didn't do my research and due diligence to realize that okay, most doctors want you to be on medication again, even though fertility wasn't an issue. It's just I didn't have a male partner, so that was hard. And then the other hard part, which a lot of people don't know, that this was very enlightening to me, is when I came off of the medication at the 12-week mark of the pregnancy. When you come off of progesterone, it usually leads to bleeding, and a lot of women use it as to start their menstrual cycle. Well, a lot of women will bleed during pregnancy because they'll get something called a retroplacental hematoma that comes loose. And so you have bleeding just like a menstrual cycle. And I had that at 12 weeks, but I didn't know that. So I thought I was going through a miscarriage. And so that's why a lot of women can actually go through pregnancy and not know they're pregnant because they have a hematoma. So they can get 5 or 6 months along and not know they're pregnant. And a lot of times we wonder, why in the world does she not know she's pregnant? Well, she may have been bleeding and had a retroplacental hematoma. There's another type of hematoma out there as well. So I had that, and it was very traumatic. I mean, I cried so much in 24 hours, more than I had in my entire life, because I was like, this is my once and done. Like, I can't believe this. So, just to share that a little bit for any women and even men listening, that if you know someone who's pregnant and they start bleeding, not to say they're not having a miscarriage, but there is some hope.